Every single day, 140 billion bacteria leave your mouth. Not just bacteria, fungi, viruses, and microbial byproducts you've never heard of. They travel silently through your saliva, through tiny vessels in your gums, through your bloodstream. And according to researchers at Harvard University, São Paulo State University, and the University of Otago in New Zealand, they don't stop at your throat. They reach your gut. They reach your heart. And in a study published in the journal Science Advances, scientists confirmed they reach your brain. So here's a question no one is asking at your dentist's office. If 140 billion microbes leave your mouth every single day, what happens when the wrong ones are in charge? The answer is something that affects far more people than anyone wants to admit. Persistent headaches with no clear cause. Sinus congestion that never fully clears. Digestive problems that no gastroenterologist has been able to explain. Brain fog that makes simple tasks feel impossible. Cardiovascular risks that emerge without warning. And yes, bleeding gums, cavities, and chronic bad breath that no amount of brushing seems to fix. If any of this sounds familiar, you are not imagining it. You are not unlucky. And you are almost certainly not doing anything wrong. What's happening inside your mouth is the missing piece that medicine has overlooked for decades. Here's what the science actually says. Your mouth is not just a cavity for chewing food. It is the most complex microbial ecosystem in the human body, home to over 700 distinct species of bacteria, fungi, and microorganisms. Scientists call this the oral microbiome. And like any ecosystem, its health depends entirely on balance. When the good bacteria outnumber the harmful ones, they perform functions your body cannot do on its own. They carry minerals from your saliva to the surface of your teeth to aid in remineralization. They transport oxygen to feed your gum tissue. They neutralize free radicals and break down cellular waste. According to bacterial geneticist Alex Myra of the Fasabio Research Institute in Valencia, Spain, as humans evolved, we outsourced a critical part of our body's protective processes to these microbial communities. Our own biology was never designed to function without them. But here's the part that changes everything. A landmark declaration published by the Journal of the American Dental Association stated that in cases of periodontal disease, there is not one specific harmful bacterium that causes the condition. Instead, everything depends on how strong the community of beneficial bacteria is when germs attack. This overturns more than a century of dental dogma. The problem was never too many bad bacteria. The problem is too few good ones. Scientists call this the terrain theory, the idea that a well-balanced oral environment makes it nearly impossible for harmful organisms to take hold and cause damage. When the terrain is compromised, everything fails at once. Gums begin to pull away from teeth. Tissue becomes inflamed. Harmful microbes proliferate. And every time you swallow, every time you chew, every time you breathe through your mouth, those microbes get carried to the rest of your body, and this is where the research becomes genuinely alarming. The bacteria that originate in a compromised oral environment have been detected in arterial plaques in patients with cardiovascular disease. A 2009 study found that over 98% of women studied with obesity shared similar disrupted oral microbiomes, suggesting that the cascade of metabolic dysfunction may begin not in the gut, but in the mouth. Bacterial toxins that travel from the gum line into the bloodstream have been found in brain tissue, where researchers believe they may contribute to the kind of inflammation linked to cognitive decline and memory disorders. And because part of the oral microbiome migrates upward through the nasal passages rather than downward, many people with chronically clogged sinuses, persistent allergies, and recurring headaches are unknowingly experiencing the consequences of an oral ecosystem in collapse. Leave a comment below telling us where you're watching from and if you know someone who's been struggling with any of these symptoms without answers. Share this video with them. It might change their life. So what destroys the oral microbiome in the first place? The answer is something you use every single morning, convinced it is protecting you. Many of the most popular dental care products on the market, contain ingredients that were never designed to discriminate between harmful bacteria and beneficial ones. Sodium lauryl sulfate, a detergent compound found in a majority of toothpaste brands, disrupts the microbial membrane of every organism it contacts. Chlorhexidine, the active ingredient in many mouthwash formulas, has been shown in a 2020 study to significantly increase oral acidity and reduce populations of beneficial bacteria in healthy individuals. Synthetic fluoride compounds, artificial colorants, propylene glycol, and plastic microbeds compound the damage, creating a chemical environment in which the healing strains at your gums and teeth depend on simply cannot survive or reproduce in the balanced, diverse numbers your body requires. The result is a mouth that looks clean on the surface and is in biological crisis beneath it. A terrain that has been chemically sterilized to the point where harmful organisms, which always find a way back in through food, air, and social contact, encounter no resistance at all. Every cavity, every bout of gum bleeding, every instance of bad breath is a signal from that terrain. The protective community has been eliminated, and the damage is accelerating. The solution, then, is not more aggressive dental treatment. It is not another round of antibiotics that will erase what little microbial balance remains. The solution is the one thing that conventional dentistry has systematically ignored: populating the oral microbiome with the specific beneficial bacterial strains that were designed to live there. Not generic gut probiotics, which are destroyed by saliva and stomach acid long before they reach the tissues that need them. Not supplements that dump dozens of incompatible strains into a chemical battlefield. Specific, clinically studied strains delivered in direct contact with the oral environment, in a format that activates them the moment they meet saliva, allowing them to colonize and begin their work before they are ever swallowed. Clinical research has identified several strains with extraordinary relevance to oral health. Lactobacillus reuteri, studied in approximately 19,000 individuals across more than 220 clinical trials, produces antimicrobial molecules that inhibit the reproduction of harmful bacteria by up to 86%, while leaving beneficial strains intact. Lactobacillus paracasea has been shown in at least 5 clinical studies to significantly improve symptoms of allergic rhinitis and airway inflammation, precisely the kind of systemic, the effect that begins with a restored oral terrain. Bifidobacterium lactis accelerates the absorption of minerals into gum tissue and has been shown to reduce periodontal inflammation and prevent the bone loss associated with advanced gum disease. 2 additional strains, Salivarius A2 and Salivarius B, work together to maintain the immune integrity of the oral cavity, ear, nose, and throat, and to prevent and even reverse tooth staining without abrasive chemicals. When these strains are combined with inulin, a prebiotic that amplifies their population in as little as 3 to 4 days, along with natural, tooth-whitening compounds like the malic acid found in strawberries, and mineral supports like decalcium phosphate that the body uses directly for enamel regeneration. The result is a comprehensive biological restoration of the oral environment. And because 140 billion microbes travel from your mouth to the rest of your body every single day, what happens in your mouth does not stay in your mouth. Users of this approach have reported not only the resolution of gum bleeding, tooth sensitivity, and bad breath, but also clearer sinuses, fewer headaches, improved digestion, and better sleep. All of which the science of the oral microbiome now explains in full. This is the connection that medicine has ignored for too long. Your mouth is not separate from your body. It is the gateway to it. And restoring the microbial ecosystem that was supposed to protect that gateway is not an alternative approach. It is, according to the clinical literature, the most direct route to whole body health that begins in a place you never thought to look. If you want to learn more about how to restore your oral microbiome, the link is in the first pinned comment below.